We're going to talk today about key phrases. These are key phrases that patients use, word for word, usually, that immediately will tell you exactly what adjustments they need to correct the problems. When patients have complaint of headaches, it can be upper cervical. That's usually kind of the normal thing that most chiropractors look at, but it also can be lower cervical at C7T1 area right here. So you can get headaches from this area. It will actually pull on the muscles and create a headache in the patient. When you find a patient comes in that says they have dizziness, dizziness is almost always C3, left anterior on the left side. Usually it clears up when you get this corrected, get this put back into place, their dizziness will go away immediately. Patients that complain of difficulty swallowing, a lot of times that can be an anterior vertebrae. You're going to find that anterior vertebrae are the ones that cause the most severe symptoms in your patients. When you have a patient that drops to the floor in pain and can't get up, usually you can pretty much be certain that it's an anterior lumbar. Anterior vertebrae actually put pressure on the spinal cord, causing way more pain and way more instability feelings of not being able to move or get up, or many people have very difficult, painful problems from the anterior vertebrae. So we're going to talk a lot about that. Dizziness caused by anterior vertebrae on the left, usually on the left, C3. C3 is usually the culprit. Somewhere between C2 and C3 you will find the cause of the dizziness. And I'm going to show you lots of good little techniques to fix that and get that corrected, and you'll find that the dizziness will go away nearly immediately. Difficulty swallowing, a lot of times that's caused by an anterior vertebrae in the neck. It can give you a difficulty time to swallow, and it also will sometimes cause a puffy neck in the front. Numbness and tingling in the arms and hands. The nerves go down from out of the lower neck into the arms and hands, and numbness and tingling in the arms and hands are almost always C7T1 in this area and the lower neck. Numbness and tingling is usually caused by vertebrae being out of place in the lower neck here from C7 down to T3. One of the things they don't really teach you in school is down into T3 you can even have numbness and tingling down the back of the arms. So I'm going to show you some really good techniques that I've been taught. Dr. Kane taught me some excellent techniques for getting this lower neck, and we're going to show you that a little bit later on. Difficulty getting a full breath. Gosh, I just had an incident of this with my daughter at Christmas time. Usually it's T2. T2 is the culprit. It gets twisted just like this one right here. There's a T2 right here. Actually that's T3. But they get twisted over and they will cause you not to be able to get a breath. You'll find that your patient is going, trying to get a full breath. It's almost like they're asthmatic. My daughter at Christmas time actually fell under the Christmas tree with her arms up, and later that day she started coughing and coughing and coughing, just constant coughing, no break, constant coughing. And I looked over and I noticed that she was having trouble getting a breath. She was like that, and it turned out to be this very culprit here, T2, T3 area, up into the first rib, and it was causing her to be in total distress. We would have been taking her to the emergency room if I hadn't been a chiropractor. So I find that this is a very common symptom. It doesn't happen all the time, but if you catch this, it'll really, really help your patient to be, their breathing is really affected by this area. Rib 4, 5, and 6 is where heartburn takes place. Now, a lot of people in this world, in this country, take medication for heartburn. They would be very surprised to know that if you get your rib fixed, that the heartburn will be completely gone and you will be off of any kind of medication. So these ribs down here, and I'm really not sure exactly what the mechanism is, whether it's because they physically distort the sphincter, where the esophageal sphincter, and allow the acid to come back up, or if it's because they overstimulate the nerves to produce more acid, and it could be a combination of both. But once you correct this rib problem, you're going to find most people don't have heartburn anymore, which is such a blessing. If you've experienced having heartburn, it's the kind of heartburn that you drink water and you get heartburn. It's not like you eat a bunch of weird food or anything. It's mostly it's a positional type of heartburn. So when people say they have chronic heartburn, it's definitely check this area in the rib cage. And usually you'll find that the ribs that are out are tender in the front. So when you palpate them, the person will go, ow, it's tender. And truly, that's what happens when they're out. They get tender. When you get down into these lower ribs down here, you can get a feeling of nausea, just like you're going to barf, just like you're going to throw up any minute. You can feel like that for days. And it's because of these lower ribs. I've even experienced that myself. Any kind of difficult digestion problem where they have difficult problems with digestion, it doesn't seem to work, or they get a lot of, feelings. Usually you should check the ribs, because the ribs are very, very tight in with the digestive tract. Okay, another problem that you might find patients have is hiccups and burping. That's usually a problem down here in the lower ribs, the ones that are close to the diaphragm. I actually had a patient who was having constant hiccuping, just really, really horrible. He went to the emergency room. His family and him were up all night with hiccuping all night. And it was real spasmodic hiccups. And he came in, and I did an adjustment, and I found a couple of vertebrae that he'd pulled out right here in the lower area of the rib cage, right around the diaphragm. So I put those back in place, and lo and behold, 2 adjustments, all his hiccups were gone. He spent the night in the emergency room, so I'm sure he didn't get much relief there. But we can help that, so let's all be aware that we can help those kind of problems. If you have anybody that has difficulty or sharp pain with breathing, that's usually a rib. If they say they have burning in the back, in this area, that's usually an anterior rib. The rib moves forward and causes the burning in the back. So if they say it's burning back here, or they got a catch back in the back, check for ribs. When you get down here lower, you can have lots of different things. A lot of times people get a bad twist down here in the lower upper lumbar area. The lower lumbars here, and when they move anteriorly, I told you about how much pain they can cause. They can make you drop to the floor. And anybody that gets that much pain, really think in your head, suspect that they may have an anterior vertebrae down there before you even do anything to them. So if you get an anterior vertebrae in the lower back that's just subtly out, the person will have a problem with getting up a lot at night, frequently getting up to urinate at night. It's usually a problem with the vertebrae puts pressure on the bladder somehow, on the nerves to the bladder, and it causes them to have to wake up 2, 3, 4 times a night and go to the bathroom. So I find that correcting that lower, I tell them, once I correct your anterior vertebrae in your low back, you'll find that you can sleep all night and you don't have to get up. So that is another thing, another symptom of an anterior vertebrae in the lumbars, usually L5. Any kind of groin pain, this is a very common area to pull out when you have a slip and fall. When the person's foot goes forward like that, it usually separates the pubic bone. So you will find that people get these pubic bone separations. And this guy can move almost every direction. It can move up, it can move down, it can move lateral, it can move medial. So it's important to use the testing system to figure out exactly which way the pubic bone is gone. And I will show you some really easy ways to put that in with the drop table. And it's very quick and easy, and the patient will feel so much better. Oftentimes when this pubic bone gets out, it'll radiate down the leg. It'll make them feel like their leg is going to give out. It'll have like a really sharp radiating pain down the front. Usually you can tell by the amount of pain that they have a pubic bone problem. One of my favorite things to treat is when they come in and they say they have a sharp stabbing pain in the SI joint. They'll usually point right here and say they have very sharp pain like a knife stuck in their back. That is caused by misalignment of the ilium and the sacrum moving anterior. So when we correct it, I'm going to show you a way to break it down in pieces and correct it from each direction. And by the time the person gets up off the table, the pain will be gone. So it's almost like a miracle. I think it is a miracle. And it really is an amazingly easy thing to fix. I like it when I see that in my waiting room, because I know I'm going to be able to help them, and they're going to be very impressed before they even leave, because they're going to be walking without that horrible stabbing pain in their back. When they have a pain that feels like they'll tell you their leg is going to give out, like it feels like their leg's going to give out, like it's weak and it can't hold their weight. Many times this is a misalignment down here in the hip and the socket, where the hip joins into the socket. So when the hip is not sitting in the socket, and you see this labrum, this socket is pretty large, so the hip can move around and still not be completely dislocated, but it can be in such a bad position that you can't really function. I just had one this morning that came in, and she had amazingly been playing on a stripper pole at her friend's house last Friday night, and somehow she had knocked her whole femur out of place, so she could barely walk. In fact, when she came in yesterday, the first time, I helped her up the hall so she could get to the table. I was actually supporting her weight. This is a very, very debilitating thing when the femur gets out of place because, you know, with your whole weight on it, your body is going to tell you, no, don't do that. So the femur can move around in many different ways. A lot of times when you have a slip and fall, again, where your foot goes out, it'll flip forward in the socket and it'll be very hard to walk or do anything. It'll affect you at the knee, it'll affect you at both ends of the femur. So that's something to look at, and I'm going to show you some really good adjustments for putting that femur back in the socket. These bones can move around in all kinds of different directions. You can get a problem in the knee from the patella moving up. It can move up from somebody kneeling a lot on their patella. It'll shove that patella up. It'll feel like their knee is just completely locked up. It'll be very painful and feel like they can't really use their knee at all. These bones can go, many times the knee goes medial. Both pieces of the joint go like this, and it does what I call a teepee effect, where it comes together like that. So that is another thing I'm going to show you an easy way to correct. A lot of times when you have a knee problem, the meniscus gets pushed out. I'm going to show you how to push the meniscus back in and fix that kind of problem. It's like a burning pain in the knee, and it'll go away immediately. Sometimes you'll be thinking that you have some kind of a problem with pain radiating down the leg because the patient will say they have pain down the side of the leg, right here along the side. Well, actually, the fibula pops out of place. This fibula gets out of place pretty easily, especially if you're twisting off on it, and you'll get a pain down the side of the leg that'll mimic a radiating pain from the lumbars. Especially if they have a SI pain in combination with the fibula pain, you're going to think they have radiating pain down the leg. So one of the things I always try to do is test it out and make sure that the fibula is in place when I find that they have a pain down the leg like that. Many times people get the metatarsals out. They walk on high heels and get these guys all sprung into a weird way. I had a chiropractic vet who actually had kind of a Dutch shoe item here with her feet because she was always kneeling with one foot behind her, and it rearranged her metatarsals and gave her foot pain. Many times people complain about foot pain, and it's really just a little drop metatarsal or a misaligned metatarsal, and boy, can these guys be painful, especially when you put your weight on it. So I'm going to show you some easy things we can do on the drop table to put the arch back in their foot, to put the metatarsals in, to help all those problems. A lot of times a very common one I find is the calcaneus gets rotated, and that is very painful. That'll give you, especially when you wake up or get up in the morning, you'll have so much pain in your foot that it's very hard to walk at first. So a lot of these problems are very simple corrections, and I'm going to show you a lot of ways that we can correct all this stuff. Another one of my favorites that is very common is the bicipital tendon. The bicipital tendon is, of course, the biceps muscle becomes a tendon. It has to sit, the little tendon has to sit right in this groove here, and it connects up here on the acromion process. Well, if you are doing too much rotation, internal, external, with your arm in any way, or forcefully doing it, you could actually flip that little bicipital tendon up on one side or the other of the groove. And it's very painful. It aches and aches. It makes it difficult to do this, makes it difficult to do this motion. You're going to find that those are pretty diagnostic. You ask the patient, can you do this? Can you touch it, pull it down your zipper? And they're going to say no. So one of the things that I'm going to show you how to correct is how to set that little bicipital tendon back into the groove in an easy way. People can get arm and wrist pain. These get misaligned many times, you know, from different kinds of motions you do, picking up things too heavy, picking up things in an awkward way. So this is another one that I'm going to show you how to fix all the little bones in the hand and in the wrist and the elbow, shoulder. We're going to talk a little bit about setting curves in the neck, setting curves in the low back. We're going to talk about jaw, misalignment of the jaw. The jaw is held on totally by muscle, so you can see how it can go almost any direction.